Good afternoon, everybody, and welcome to the Argyll and Bute Health and Social Care Strategic Planning Community Consultation event. We're going to get started in a few minutes. If you'd just like to hold on, we've got a few more people trying to join. We'll start the webinar at 3:05. Thank you. Hello, everyone, and welcome if you've just joined us to Argyll and Bute's Health and Social Care Partnership Community Consultation event. We're going to get started in a few minutes, but we're just welcoming a few more participants. Thank you. We're just waiting a few minutes to start. There's still a few participants to join. Thank you. Hi everyone, and welcome to Argyll and Bute's Health and Social Care Partnerships Community Consultation event. We're just going to give it one more minute and start at 3:05. We're just waiting a few more people to join the room. Thank you. Hello and welcome everyone. Thank you for joining our Strategic Plan Community Consultation event today, and also if you're watching this as a replay. My name is Kristen Gillis and I am a Senior Service Planning Manager for the Health and Social Care Partnership. I would also like to welcome Nicole, our BSL interpreter today. On stage with me today is also Fiona Davies, our Interim Chief Officer for the HSCP, and also Caroline Cherry, our Head of Adult Services for Older Adults and Community Hospitals. It's our role to write our strategic plans, working with all our partners, stakeholders, and specifically our residents in Argyll and Bute to develop our planning. This next strategic plan for 2022 to 2025 will be the HSCP's third and possibly the hardest one for us, given the current difficult times we see our services in post the COVID pandemic, and with all the changes to legislation on the horizon mainly the National Care Service and the Independent Review of Adult Social Care. It's also an exciting time because COVID has forced us to enact changes and seize opportunities when they've come our way. We know we have lots of rural challenges and our demographic can be perceived as challenging. But with the recent rise in the use of technology and the increase in local community-based practices, we have the opportunity to share and spread and learn and develop the way we deliver services, preparing us for the future. This strategic plan outlines the Health and Social Care Partnership's vision, values, and outlines how health and social care resources are governed, allocated, and operationally managed. The HSCP has set out 4 new priority areas that we want all of our services, whether they're internally provided or purchased externally, to work towards. These are prevention, early intervention and enablement, choice and control and innovation, healthy living and active citizenship, community co-production, which means working with communities to produce local services. And Fiona's going to talk a bit more about this with you this afternoon. Before I hand over to Fiona and Caroline to talk you through this, this is your opportunity to provide us feedback and ask questions on our strategic plan direction. And I want to thank you all for your attendance today, and I hope that you do get a lot out of it. There's an opportunity for you to post questions and make comments or provide us with feedback within the chat function here today. And if you're watching this in replay, please post your questions on the Slido link. Slido is a community listening tool, and we will take these questions after the presentations and answer the questions for you throughout the duration of this consultation period. So without further ado, can I please welcome Fiona Davies, our Interim Chief Officer, to the stage. Thanks very much, Fiona.
Thank you, Christine, for that great introduction. And hello to everybody that's on the call. I'm already enjoying seeing all the places that you're telling me that you're from in the chat, so do feel free to keep that coming, and as Kristen said, to keep your questions coming as well. So as Kristen said, I'm Fiona Davies and I'm the Interim Chief Officer for Argyll and Bute Health and Social Care Partnership, and thank you so much for coming along to our first live interactive webinar. Firstly, I think that we need to acknowledge that we have been and still are in unprecedented times. We all, as individuals, families, communities and services, have had to respond quickly to the impact of COVID-19, and that response continues. However, as Kristen said, it's important we don't lose the lessons of how we all pulled together in the crisis, how partnerships were forged, how communities pulled together, and how unnecessary bureaucracy was removed as a barrier. And from these lessons, we need to move forward to plan both for our immediate time and for the future. I believe that in today's world, for planning to be valuable and successful, it really does need to be everybody's business. So we want to hear your voice, to hear what matters to you, your family and your community. We want to achieve the best possible outcomes for everybody to improve and transform our services. The joint strategic plan, which we will develop, needs to be intentional and considered about what it is we're going to do. And we can't do this on our own. We need different conversations to transform services, and we want to empower people to have their voices heard, their experience valued, and to hear collective evidence to tell a compelling story. Planning is about taking time to think about what services we want in place in response to the needs of local communities, islands, families and individuals. There are some services which are available to everybody, which can be both preventative, like vaccination and screening programs, or available when we're feeling unwell, like GPs and pharmacists. However, there are times when each of us can be more vulnerable and need health and social care, specialist or support services. This could be due to our age, a medical condition, disability, trauma or life circumstances. And these services are often not provided directly by the HSCP staff, but we purchase them, if you like, from the marketplace which includes third sector and private sector organisations within it. So part of what we're doing in our plan is ensuring we have the right mix of purchased and internally provided services. We've set out our vision that people in Argyll and Bute will live longer, healthier and independent lives. And those high-level priorities have been set for us to achieve that. As Kristen says, the first of those is that we want to see prevention, early intervention and enablement. Secondly, we want to ensure people have choice, control, and that innovation is available. Thirdly, we want to encourage healthy living and active citizenship. And finally, we want to do that in a way where we co-produce the answers and the solutions with our communities. The delivery of high-quality, person-centred health and social care services is fundamental to achieving our vision. We can only deliver this vision if we have a sustainable and diverse health and social care market that is equipped to deliver personalised, flexible and innovative high-quality services across all of our communities. So together we want to map a realistic picture of what can be a complicated landscape and create the conditions where we share our resources, maximise the potential of the totality of our assets, and sense check this approach with those that matter. And that includes every member of staff, people that use our services, organisations that provide services, and the communities within Argyll and Bute. I really hope you enjoy this webinar, and I look forward to hearing your comments and responding to some of your questions later in the session, or for those of you that are watching it on record at a later stage when we get your questions through the Slido tool. Many thanks.
Thank you very much, Fiona, for that introduction. Can I remind all of our participants today that you are welcome to pose us some questions. If you'd like to put them into the chat bar, we have some moderators in the background who are helping us with that. So there is an opportunity for you to provide feedback and to ask us some questions. So without further ado, I'm going to invite Caroline Cherry. Caroline is our Head of Adult Services for older adults and community hospitals. And Caroline is going to give us a presentation this afternoon. So over to you, Caroline. Thank you.
Okay, thanks, Kristen. Can I just check that everybody can see the presentation?
Yeah, Caroline, that's up now. Thank you.
Okay. Apologies, folks, a few technical hitches, so I'm working from my own version. So really welcome everybody. I'm delighted, if a little bit nervous, to be involved in my first ever webinar. So it's technology for any age. I'm really pleased to be here. I'm going to give you a fairly high level presentation. It focused primarily on the service areas that I'm responsible for. Happy to send out the presentation, I'm sure, at a later date. And for those of you that might have seen this presentation before, apologies. So if I can go to the next slide. So, and hopefully this is matching up with what you can see in the screen. So the aim of the presentation is to first of all, particularly around older adult and adult care, hospitals, community and dementia services, and have a think back to what's happened in those couple of years, and also think about what evidence we have and what our demographics are telling us and the strategic context in which we're working. And as Fiona said, it's important that everybody's involved in this conversation, and this isn't the only opportunity to engage with the strategic plan, and we'll be doing these different sessions at different times. So if I start with the overall aim, that for older adults, our aim is to ensure that older adults live in their own home or in a homely setting, and we call that home first. That's primarily what our services and our staff are doing and supporting with, hopefully, day in, day out. So I'll move to the next slide. So as Fiona said, it's very important, I think, that we do spend a little bit of time reflecting on the last couple of years, which have been very difficult and challenging for all of us. So I've been here, I think it might be 2 years today, in Argyll and Bute, and the services I'm responsible for are hospitals, all community services for adults, particularly older adults, dementia services, day services, care at home and care homes. And I've used that term, what we provide and what we commission. So as Fiona said, some of the services we provide ourselves, and in other services we commission from a range of colleagues. Since we produced the last strategic plan, what none of us could have foreseen is that we were hit with a global pandemic. And so everything we do now has to incorporate the learning that we have from COVID-19. Some of the lessons learned, and one of the lessons I've learned, is about the importance of the impact of loneliness and isolation on older people's health and well-being, and the pivotal role that community-based supports play in quality of life. And as Fiona mentioned, there are also strategic developments like the National Care Service, which are on the horizon. So next slide, please. So I've called this slide the voice of lived experience, and there's a quote and something that made me stand out in a statement from Age Scotland, from a survey, that 1/3 of older people feel that they are made to feel like a burden on society. And I'll use that term, made to feel. And I think it's so important that we think about every interaction and relationship we have with older people. And what I've said in this section is that older people, whether we call people patients, service users, carers, need to be at the heart of any changes we make. One of the areas that I don't think we've been as good at, and I'll just use my own service for an example, is involving older people and adult service users in those developments, and we absolutely have to strengthen the voice of lived experience. And one example of that is, very recently we've developed an older adult dementia reference group, and that reference group is going to be one, not the sole, but one of our key developments, where we'll take ideas and proposals and we'll check out with that group how they view those developments. When I did this presentation to staff, what other ways can we listen and experience the views of service users and patients? So we could move on. So I'm going to spend a couple of slides talking about dementia. It's an area where we have actually made progress in the last couple of years, and it's an area of transformation for the Health and Social Care Partnership. So if we can just think, in Scotland, there are now 20,000 new diagnoses of dementia every year. And I'm just going to read you the national vision for dementia. The shared vision is of a Scotland where people with dementia and those who care for them have access to timely, skilled and well-coordinated support from diagnosis to end of life, which helps achieve the outcomes that matter to them. So there's a little bit of a change in how we now focus our thoughts about dementia. In the early days of the strategy, there used to be a real focus on post-diagnostic support. And whilst that's incredibly important, we also have to support people through the whole journey of dementia. And as we grow our service, which I'll come on to talk about, we also need to grow the awareness and support within communities of dementia. And it's a really obvious statement, but we need a dementia strategy for Argyll and Bute, and we currently don't have that. So we could move on, please. So just to tell you a little bit about some of the developments that you may not be aware of, we've moved quite significantly in the last couple of years to an enhanced community dementia model. That was agreed as part of quite an intensive period of consultation. And it was agreed that the current model as it stood of one long stay ward wasn't sustainable, Our community services for dementia were very, very small whilst we sustained the ward. So the ward in Locality was closed, and that enabled the development of the enhanced service, which took place under a dementia redesign group. And it was important, and it still is important, to acknowledge that we already had existing staff and services in place, but the service was not adequate and needed to grow. So we're not there yet. We're not finished, but we've got a model of a multidisciplinary team. We are training nurses to become advanced nurse practitioners with a speciality in dementia. We have CPNs, community psychiatric nurses, social workers, occupational therapists, healthcare support workers, and Alzheimer's Scotland link workers. This is a really incredibly important partnership with Alzheimer's Scotland. And our task is now to embed this team and ensure we meet the key outcomes to ensure that, in addition to community supports, I'll say that part again, that we have community supports, we have this service, and we also look at dementia care home provision and placements. So we could move on, please. So I'm going to spend a couple of slides on care homes and housing now and in the future. So again, prior to the pandemic, the Health and Social Care Partnership had actually undertaken care homes and housing as an area of transformation for over a year, to review care homes and housing and look at provision, projections of need, and engagement with local areas. And it's obvious that any developments need to be based on needs. It's also clear that there is inequitable provision across the HSCP. Now, unfortunately, and it was unfortunate, I know there'll be people around this virtual room who were involved in the work. So thinking about this now, I've probably spent an awful lot of my time over the last couple of years trying to support our care homes in the midst of COVID. It had a devastating effect on care homes, residents and staff, and our occupancy hasn't quite returned to pre-COVID levels. What's been positive in some ways through this dreadful time is that there's been a real focus on care home assurance, quality and support, both at a national level and at a local level. And at a local level, we have a local assurance function, which discusses and looks at our care homes several times a week, three days a week at the moment. We also have a care home task force, which has been a really pivotal partnership. It's included every care home in Argyll and Bute, along with health protection colleagues, public health, finance, employment, wellbeing, and it's been a great partnership, and that's something we really strongly want to continue with. So we could move on. So we picked the work back up in early 2021, and it's now redeveloped, and we have a care home and housing programme board. So the aims of the board initially were to look at the outcomes of comfort and suitable environment for our care homes, some of which don't meet standards and do require investment. And alongside that, to develop a strategic vision for care homes and housing, ensuring that there are flexible models to meet needs and a recognition of the aspiration of most older adults to stay close at home. And that's very challenging in the rural and island population that we have within Argyll and Bute. As I noted before, our strategy really needs to drill down on the evidence base of need and demand. What is that telling us for the next 5, 10 and 15 years? And as you'll know, within Argyll and Bute, the workforce is central to any development. It's all very well having these aspirations and plans, but where are we getting the workforce from? So we could move on. So linked to care home and housing is this term, which is called intermediate care. Some of you might know it as step up and step down. So intermediate care is described like a bridge. It's a bridge between two settings. It has a focus on rehabilitation and a focus on outcomes. It's different from respite in that there has to be a goal of rehabilitation and support to achieve that goal. And in other areas, they have standalone units for intermediate care. Sometimes they incorporate intermediate care within other settings. It can be a help as a transition to getting home, so a step down, coming out of a hospital and having a period of rehabilitation. It can also help to have time to refocus and be able to maintain living in the community, and we call that a step up. We do have some provision within Argyll and Bute, but I've said pretty bluntly, we don't have a clear model. We don't have a model of the provision we require, and we haven't worked out where that provision might be. And clearly, it's not just providing a placement, but it's also providing the staff, the model, and the processes to make sure that we actually deliver it. So we could move on, please. So I mentioned the term home first, and this is a national term. It's not something we're just using ourselves, but it does what it says in the tin. Our first and prime focus needs to be supporting people to remain at home. And the next two slides really just describe what any system or structure of home first should have. So the first term is anticipatory care. Now, I've put that in the language that I understand it to be, which is just making sure your intentions are clear. Anticipatory care is quite wordy, and some of the materials we have been quite difficult to implement. And we discussed that with staff. We had the staff workshops. But essentially what it means is that your care, your intentions for your care or your treatment to be embedded, and so we don't move people into situations that aren't helpful for them. Integrated community supports, and I'll come on to talk about that. Integrated discharge planning, which includes access to equipment and adaptations. And, you know, we have some great examples in Argyll and Bute. We do really well in a lot of these areas. So it's not just about getting somebody home. What about the equipment they need? What about the adaptations they need? What about the technology they need? How can we bring all that together so it is coordinated? Building capacity for care and support at home, and I'll particularly go on to talk about care at home. And the assertive management of risk with use of telehealth and telecare, which again, we have some good models and examples of in Argyll and Bute, but it needs to be embedded. It can't just be it needs to be embedded throughout the system. So we could move on to the next slide. So just this last slide on home first, we need to have a clear policy and arrangement on interim placements. So a little bit like intermediate care. What if we can't provide, what if somebody needs that little bit of a bridge? What's our policy? What's our arrangement? Is that clear to people what that is? The assurance that quality of care is in place. Adults within capacity, and you will know that can be a really long process. So adults within capacity, and as part of that, campaigns around a power of attorney and making sure that that is in place. Joint commissioning and resourcing, and I've added this and thought about this, and maybe this is something we can come back to, but there's a role for community resilience here. This is not just about what formal services can do and can offer. There are lots of fantastic supports within our communities that help people stay well, and we just really call that community resilience. So we could move on to the next slide. So we just reflected there that for the staff, we reflected that we've got some really good elements of service provision. They don't always work well together, so sometimes the communication isn't the best. Sometimes they're not available at the time that they need them. We did in Argyll and Bute, as well as other areas in Scotland, look at the Birtsorg model, which has the ethos and principles of the person in their community, but services are too complex to be structured to that model very clearly. And for this, some of these slides may seem a little bit focused on the staff, and that's because I've just adapted the presentation. But the next bullet point I've said there is that we sometimes don't know what's available in the community. And with health and social care, we have an occupational hazard in that we want to help people. And sometimes what we do is we bring people into services rather than signposting. And that was very much picked up in the National Care Service. Prevention should be a huge part of what we all do in the community to prevent the need to have more formal services. And I just referenced there the eligibility criteria to service. There's a national discussion on how that will be changed. We have a work stream called Community Assets within Argyll and Bute, and that was our early push to work on prevention and those strategies, services and supports that keep people well within their own communities. So we could move on to the next slide, please. So this slide is really about care at home, and it's absolutely the foundation of the majority of services to support somebody at the moment, as lots of areas have, and it's a big conversation we could spend the whole afternoon on. At the moment within Argyll and Bute, some of care at home we provide internally by the council, and some again we commission. If I look back at Argyll and Bute, and I'm being reflective and just taking a step back and looking at Argyll and Bute, some of our services have been built by default rather than design. So we've historically had arrangements in place, and we need to take a step back and look at that. There's going to be, and there has been, and there will be a growth in care at home. This is a service that should grow, and there's going to be, and there will be, a huge focus on trying to attract and retain care workers. And as I've said, there is a national conversation at the moment about how we do that. We have to build, and we do have a good partnership with all providers, service users and staff to develop the strategy on care at home and what supports the service. And the last bullet point really reflects that conversation. What is care at home and what is it not? And there is some internal improvement and governance that we need to put in place. So we could move on, please. So good to see some of you here from islands today. There's a focus and a discussion here on islands. So care on the islands now and in the future. So we had the Islands Act enacted in 2018, and there is a national islands plan, and there are 13 strategic objectives. And for health and social care, we have to play a critical role in joining up that realistic health and social care service. And we've currently been doing a little bit of work to get that conversation going in Tyree and Mull, but we need to do better than that. I've said they are developing unique island solutions. So again, I'm just going to be really personal from my own learning, having not worked in an area with islands and never lived in an island. I've clearly learned that every single island is different. Every single island has its strengths and its challenges, and the solutions need to be unique for those islands. But that involves a really important conversation with all of our islands about how we do that, given the services that we have. So we could move on, please. So a brief slide on hospitals. And again, many of you will know that our community hospitals throughout Argyll and Bute is an absolutely unique model in Scotland. Community hospitals elsewhere are very different. We have the A&E function within. Our community hospitals were designed to meet the rural, remote and rural locations that we have. They provide a range of services, but we need to extend those services into the community and try and provide some of those services at home. And the skills that we can pull into the community. They should be able to offer outreach and support to that community resilience at home. And in many areas, they're absolutely at the heart of the services we deliver. We're doing a lot of work at the moment on redesigning unscheduled care so that kind of right place, right time care that needs to be embedded, and that there's work going on as part of our whole systems approach to develop that. And lastly, within our hospitals, our rural general hospital in Oban, like several of the rural general hospitals across Highland, needs a sustainable and flexible workforce to deliver the range of specialist functions that they do for Argyll and Bute. So last slide. You'll be glad to know, and I hope I haven't talked for too long, that that's my last slide. Thank you very much for listening, and I'll hand back to Kristen. My contact details are there if you want to get in touch with me. Thank you.
Many thanks for that, Caroline. And you have provoked lots of chat and questions, which I'm absolutely delighted to have seen coming in. So I think that's what we'll do now. We'll just go along and pose some questions to you and Fiona, if that's okay. For participants who are watching this on replay, please remember not to post any comments on this webinar, but to go to Slido and we will definitely get back in touch with you with some responses. So if I could invite Fiona back to the stage, please. We've had some great feedback already and some questions. So I'm just going to start really at the top where they started coming in. So what does the plan say about reducing the need to travel out of the locality for non-acute services? Sorry, Fiona, did you hear that question? Okay. I'll just repeat it one more time. So what does the plan say about reducing the need to travel out of the locality for non-acute services?
Sorry, do you want to answer that, Fiona, or do you want me to? I don't think it has that level of detail, but I think there are definitely feedback, Kristen, so far, isn't there, about having services as close to home as possible. And I don't know, do you want to say anything more about that, Kristen?
So, yes, so we obviously work very closely with NHS Greater Glasgow and Clyde around how we provide our secondary care services, and we do try and reduce travel as much as possible, but equally there's just sometimes that it is essential that service users have to travel in for some of these specialist services. We are really trying to maximise the use of virtual technology to keep people as close to home as possible. Within the HSCP, we use NHS Near Me, and we partnership up with NHS Greater Glasgow and Clyde to do that. And we understand that some patients might find that difficult to engage with. So we are trialling some community hub models, and people might be aware of the Care and Do project that we've got currently going on, where we're linking with the village there, and the team in the HSCP have provided the technology to support NHS Near Me, and the staff there have been trained up to help people to engage in that virtual technology and just help when it might seem slightly daunting. We also are aware that there's a lot more telephone consultations occurring, and we are seeing that clinicians are trying to be a bit more pragmatic around how they are seeing their patients. There's obviously a long way to go. We are trying to reduce the amount of digital, trying to be more inclusive when it comes to the use of technology. Our telehealth team also have a loaning library, which can help with iPads and telephones and things like that to help support people if they don't have that technology as well. So within the strategic plan, there is definitely that innovation side of things. We are definitely trying to push the use of technology going forward. So I hope that answers that question. I'm going to move on to another question now, because we have an awful lot. This one's from Jean Knowles. Again, it's around the kind of need for travel. So Jean said, need for travel is a given in a rural area. So I would ask Maxwell to reframe his question as to how to get best value for patients for travel out with their own locality for non-acute services. And I'll just mention that was Maxwell, sorry. So Maxwell, you said that previous question, so I'm getting confused. So I'm hoping, Jean, that I've managed to answer your question there, but if not, please get in touch with us after the event and we could discuss that further. Another question is from Mary McCallum Sullivan, and she's asked, is there scope for co-production of localised services? Who would like to take that?
I'm happy to take that, and then Fiona can come in if she'd like to.
Thanks, Caroline.
Yeah, I think when I said community resilience, that's some of and the focus on supports within our communities. That's really what I meant. That there are a range of services that really can only be provided by some sectors, social work, nursing and medical, whatever. But there are a range of other services which I actually think really strongly could be co-produced. And if it wasn't clear enough, that was my very, very clear steer, maybe not clear enough to you, for the islands. We sit round a table and we say we can't just transport what we have in a mainland to an island. How are we going to co-produce what's available already there? And that doesn't mean that you're doing it for yourself, but it means, yes, there absolutely could be opportunities to co-produce. And any ideas thoughts anybody has on models for co-production, we're really, really happy to hear them.
Thanks, Caroline. I will come in because I'm just noticing, sorry to jump ahead, Christian, I'm going to be unravelling your great methodology, but Susan asked a question about why don't we include organisations in the local area who work with dementia clients. And I suppose my response to Susan would be to say, please get in touch and let us know. The whole purpose of the Health and Social Care Partnership and the Integrated Joint board and the model that sits around that is coming together, as I said into my introduction, and making the best use of all of our combined efforts, whether that's professional or from within our community. So if you think that there's a partner that we've missed or a small group that hasn't been included, please do get in touch, because we'd like to hear from you, because it may be that we can strengthen what we're doing and make it even better by making sure we're including all local groups. And I hope that would be an example of maybe a response to Mary's question.
Thanks very much. Now a question from Patrick Trust. He's saying, you have not consulted patient or client opinion for the last 2 years. Local LPGs seem to have vanished. You do acknowledge the lack, but no notice on how to progress and restart. Who wants to take that one?
Sorry, do you want me to take that? Can you repeat that one, Christian, about lack of consultation?
Yeah, certainly. So it's from Patrick, and he said, you have not consulted patient-client opinion for the last 2 years. Local LPGs seem to have vanished. You do acknowledge the lack, but no notice on how to progress and restart.
Okay, so really good question. Thank you. So I think, again, I'm not making excuses, but I think I would acknowledge that in the pandemic, put aside things and focus on that response to the pandemic. And that's genuinely not an excuse. That's what we were working on. We are starting to pick back up those important aspects of engagement, and we hope we will have some resolve to LPGs within the next couple of months. And again, that we have other engagement methods, but again, happy to hear and be involved in any discussion on engagement. No, maybe, I don't know if Fiona wants to say anything else there.
Yeah, thanks, Caroline. It was just to concur, really, that I think we have been in a process of remobilising our services, and that includes some of the functions that we've had around engagement and consultation. And so we're in the process of finalising what our arrangements will be for standing back up and remobilising those groups, because we do, as we've said, really value patient and client opinion. We have had other ways that people have got in touch with us through the pandemic, but it probably hasn't had the same rigour or feeling that you would have had from some of the previous groups. And we know that's missed. We've heard that feedback previously from others. So we'll get back in touch with you as we finalise our plans for that remobilisation.
Okay, thank you for that. So you've already touched on Susan's questions. So Kenny Matheson's asking, what is your plan to get more carers, i.e. home care? Dunoon is an urgent need of carers and families can't get packages. What is your plan?
Okay, so good question, Kenny. And again, it does. I know it doesn't help any of us on the ground, but I do reflect again that this is a national problem, a national challenge for us. Not a problem, it's a national challenge. So you'll see actually in the next, I think it's in the next couple of weeks, there's a national campaign to raise awareness of the importance of care at home. And there's a national recruitment campaign which we'll link in with. We've tried various means of recruitment. I think, again, there's a lot to this, and it can also depend where you are in Argyll and Bute. You know, what are the other kind of pools that staff have. At the moment, our focus is on managing the shorter term crisis that we have, making sure that we can try and get as much care out the door as we can, making sure we've got good communication where we've had to make changes to services, retaining the staff that we do have, and I say that within our own service, but also with our other services that we commission. We're currently doing a piece of work which is meeting with all our providers across Argyll and Bute, trying to understand their challenges and trying to support them so we can have a coordinated approach. So I can't give you a quick answer as to how we're going to resolve it, but it's really is our top priority at the moment. And as I said again, it's not a problem unique to Argyll and Bute.
Thanks very much, Caroline. Go on to our next question now.
Can I just add to that, Kristen? Because again, I'm going to do what I did before. I can see a question just a couple further along, which I think has a connection to it, because I think Jean here's made a really interesting observation about the hierarchy, as she describes it, between health and social care. And I think that's a really important point connecting to the question that Kenny just asked in relation to care at home. Because again, I think that's something that many of us would reflect has been nationally observable, that at the beginning of the pandemic, that there was a lot of public thanks and adulation that was very centred around the branding of the NHS and healthcare staff. And I know that a lot of our social care and social work staff really felt that they were maybe not given that same amount of recognition, the Thursday round of applause, etc. And there were also decisions making nationally about the one-off payments of gratitude in COVID that were maybe not done as sympathetically as they should have done to reflect the efforts across all of our health and social care staff. I think maybe that nationally there's starting to be some recognition that that hasn't maybe helped us with our recruitment and retention of social care staff. And there are some adjustments being made to national pay rates and to the recognition of one-off payments for social care staff and personal assistants and staff that are employed through self-directed payments. But I think all of us have a responsibility in how we think and feel around the responsibility and the recognition of people that undertake social care work. And obviously what we are trying to reflect in our plan and in support of those national campaigns is giving a very balanced recognition to all of our staff, whether they've got a health or a social care, social work background, that we value each and every one of them and the contribution they make to meeting the needs of our population.
Thanks very much for that, Fiona. Okay, move on to the next question then. So Jill Chasemore's asked, community resilience and third sector, well, it's more of a comment, needs to be funded, but I think it is quite a good comment to make and probably something, Caroline, you might want to come in and confirm. So community resilience and third sector needs to be funded. It's more of a comment. Suppose I would maybe just come in there to say as part of our commissioning strategy, you know, we're understanding the level of services that we currently have within the third sector and just what's in every community and that community resilience and the value that that has to us in supporting us to deliver our health and social care services And as part of those priorities that Fiona shared and talked to within her introduction, and those commissioning intentions that you would have seen, we absolutely are committed to working with our third sector and our communities going forward to ensure we build that resilience and that enhancing our local communities. So hopefully that point helps there, Jill. Also, Margaret Sherwood's asked, do you have the demographic information available to support the development of the strategy? And again, I can probably come in there just to confirm that we have absolutely worked really hard around this understanding the demographics of our population. We did this actually pre-pandemic because we were going through this cycle, but actually whilst we're in the pandemic as well, we have refreshed our joint strategic needs assessment, which is quite a fancy way of saying the needs of the population, and we're trying to understand what impact COVID has had on our population and how our services need to be changed to shape and meet the needs of our population going forward. There's still an awful lot of unknowns with that, so our team are actually continuing to monitor this and try and drill that down to more localities and islands as well going forward. So we're getting through the questions now. So Christine Woods asked, years ago, work was commenced for sensory impairment strategy. I understand this was not completed. It's great to see your translator on screen today, but will a sensory impairment strategy now be included? Fiona, are you able to take that?
Thank you for your question, Christine. I've not been around locally long enough to be able to know whether what work has happened in the past. So I'd be interested maybe in finding out some more about that if you want to get in touch, or certainly I'll ask from within people that have been working in Argyll and Bute for longer than I have been. I think the strategy at its heart lays out those principles and priorities. And I think that maybe what you're referring to here is as Kristen was talking in the last point, that we really want to get into a place where we're enabling people to live their best life. And if you were following the National Care Service consultation, that's very much the flavour nationally of the direction of travel that the Scottish Government is taking. So I don't think the plan as it currently stands has that particular level of detail in it, but I think the principles to which you're referring are included in our priorities. And I certainly will be interested to go and follow up with my team about the work that you've referred to previously and whether that's something we'd be able to look to restart. As I say, we're going through a process of remobilisation. We can't do everything that we might have wanted to do right now because we are still engaged in the pandemic response, but this strategic plan is to lay us out over 3 years. So I think it is important that we map out through that time what we hope to be able to achieve in getting into the detail of those priorities.
Thank you very much, Fiona, and we will respond to any questions today that we haven't been able to fully answer. We will get the appropriate people to answer that, and we'll get back to you with these in due course. So moving on, this is a question from Kirsty McFarlane. Good to hear about the drive to recruit and retrain. Island life is nothing like what is being described, but decision making is too slow. I don't know if there's any you want to reply to that comment, Caroline or Fiona.
I suppose I certainly wasn't trying to describe island life, Kirsty, and but I think I'd be interested in following that comment up with you. So please do get in touch with me. I think I've kind of said, I suppose we don't yet have a clear I suppose support structure to develop those conversations. Our operational managers are doing lots and lots of different jobs, and I do think we need a bit of support and a bit of direction almost around that island work. And I don't know whether Fiona would agree, but we've recognised that we need to do better. We islands, and any learning we can get from our island communities, we'd be happy to listen to, because it will be a priority for us. Every conversation I've had in the last couple of months has been around the fact that we can't just translate a service out there and it's going to be right for an island community. So please be assured it's high on the priority list, and you've got my email address. Please do get in touch.
Thanks, Caroline.
Yeah, thank you, Caroline. I would certainly agree with that. I think there's been a real recognition from the leadership team that the delivery of services on islands needs to be bespoke and needs to be understood in the context of that community, that the way that the ferries work, the way that the plane works will be different. The way that you can move around between your island and the mainland will be different in every context. So what I'm delighted to see in this proposed strategic plan is that we will put some organisation around that it won't just be ad hoc, that one island or another island will have a conversation, that we will be having those conversations in a more organised and deliberate way, so that each island will have a different conversation, but the same principles and priorities will be applied. That I suppose I'm a mum of 3. Equal doesn't always mean the same. I'm sure any of you that are parents may recognise that phrase, and I think that would be important to use here, but we need to be able to demonstrate transparently how we've come to conclusions about what's needed, and to apply that in each context in a way that's sensitive and co-produced.
Thanks, Fiona. And I'm hoping that actually helps. Patrick's got a question, Patrick McGran. How do you plan to build partnerships with local island communities? You see it as an important conversation. So I'm hoping, Patrick, that conversation that's helped you with that. I wasn't sure if you're coming back in there, Fiona. Sorry. So moving on to the next question. This is from Caroline Whitworth Foster. I have a particular concern around the lack of additional services for additional support needs and disabilities. You receive a diagnosis, but then what is available for parents to support their children and their needs? Again, the webinar has forgotten our young people.
If I can maybe just come back on maybe the scope of the webinar, and then maybe Fiona can come in. So again, this was our first webinar. I'm sure we'll be doing more of them. It was our attempt just to look at a particular area of services on the strategic plan, and not the whole area of service. It's quite a lot to get through within that hour, so it's certainly not been forgotten about, and there'll be further communication about aspects of that within the strategy. My area was particularly around older people, adults in hospitals within that context. So apologies if that feels like it's been left out. It certainly wasn't intentional. So I'll maybe hand on to Fiona. I don't know if you want to say anything else, Fiona.
Yeah, I think it's really important just to say that the plan is for all aspects and all life stages. And I think it would be useful maybe if we do a subsequent event that has more of a focus on children and families and young people. Your more specific comment about the needs of young people who have additional support needs, I think, is an important one, and is not one that will be something that's not picked up through this strategic work. I've been in conversations just this week about remobilising the strategic group for autism, and that's an all life stage group. So that's just one example. That's obviously not across all additional support needs. But again, I'd be happy to pick that up. And I think maybe that's something we can take away from today's session, is about how we do maybe a children and families focused event like this, so that we can pick up those questions in more detail with relevant staff.
Yeah, that's really important that we do that, Fiona, so I agree. So just conscious of the time, we've got time for one more question, and then we will close the webinar. So the last question is from Burt, Dr. Natchway. Sorry, I'm probably not said your name correctly. So this webinar seems to focus on older adults. What about adults with personal problems or relationship family issues? Are there services for the islands? Many people don't want to consult locally because gossip travels fast in small communities. What services, FX, I'm not sure what that means, sorry, online are available by the HSCP.
Thanks, Kristen. I don't mind taking that question. I think we just covered part of that in the previous answer, that Caroline obviously wanted to come and talk about a significant proportion of the strategic plan, but the strategic plan is much broader, and it certainly also covers mental health, learning disability, mental well-being, as well as children and families, which we've probably spoken less about today than some of the other topics. I think what you're also picking up there in relation to islands is some of that challenge that we've already been discussing, that for some people who live on an island, they need a service to come to them. But as you say, sometimes that's a barrier to accessing help for some people. They want to go somewhere more discreet or private, or reflecting that innovation conversation. They'd like to do it remotely and using the technology that we've all become so much more familiar with over the last couple of years to access services. So I would hope that this strategic plan can reflect all of those things. It reflects the focus that we need on Ireland, but that the solutions are not a one size fits all. Apologies, my lights have just gone out. I was obviously sitting too still. And that we're able to pick that up in the plan. So I hope you'll find, as you look through the plan and review it, that you can see the aspects that you're interested in, both across our mental well-being, mental health, as well as our physical health and the care of older people.
Thank you very much for that, Fiona. And apologies, everyone, that we've not been able to get through everybody's questions or comments this afternoon, but we will endeavour to answer all of your questions. We've also launched a digital community listening tool where members of the public will be able to submit their own questions, views, and share their ideas and thinking, which will also help shape our planning for the next 3 years. This will be especially important if you're watching this as a replay, so please do use our Slido tool. I'd like to thank everyone today for attending. I hope you found it enjoyable. If MD has any problems accessing this online or wishes to complete our public survey, which we're going to put, I've got two things going on here. The Slido, hopefully everybody can see this Slido coming up onto your screens just now as we speak. Can everybody see that? I'm not sure if that came up correctly. The joys of technology, but we'll make sure that you get that. We'll make sure that you get that sent over to you to fill out. So thank you very much again for joining us today. We look forward to seeing all of your feedback, all of your comments, and any more questions that you wish to pose. We will endeavour to get them all answered, and there'll be a report compiled after this event, hopefully answering all of your questions, and we'll be putting that report within our NHS and HSCP, Argyll HSCP website, and I hope that's been helpful. Thank you very much to Nicole, to Caroline, and to Fiona for your time today. Thank you all. Goodbye.
Bye, everyone.